Ocella is a combination of two hormones, an estrogen called ethinyl estradiol and a progestin called drospirenone. It is used to prevent pregnancy. In addition to preventing pregnancy, Ocella can also make your periods more regular, decrease blood loss and painful periods, and decrease your risk of ovarian cysts. It's important to note that Ocella does not protect against sexually transmitted diseases, so additional protection is needed. The recommended daily dosage is 1 pill taken at the same time each day. It's best to take Ocella at the same time every day to maintain its effectiveness. Before taking Ocella, make sure to read the patient information leaflet provided by your pharmacist. This leaflet contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, with or without food, usually once daily. Pick a time of day that is easy for you to remember, and take your pill at the same time each day, 24 hours apart. Taking this medication after your evening meal or at bedtime may help decrease stomach upset and nausea. Follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. Vomiting or diarrhea can prevent your birth control pills from working well. If you have vomiting or diarrhea, you may need to use a backup birth control method, such as condoms, spermicide. Your pill pack contains 21 pills with active medication, with hormones. It may also contain 7 reminder pills, without hormones, at the end of the pack. Take 1 active pill, with hormones, once daily for 21 days in a row. If you are using a product with 28 tablets, take a reminder pill once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are using a product with 21 tablets, do not take any tablets for 7 days unless otherwise directed by your doctor. You should have your period usually within 3 days after you take the last active tablet in the cycle. After you have taken the last reminder pill in the pack or gone 7 days without taking an active tablet, start a new pack the next day whether or not you have your period. If you do not get your period, consult your doctor. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If your period begins on a Sunday, begin taking this medication on that day. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Ocella may cause nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. Contact your doctor if these effects persist or worsen, or if you miss 2 periods in a row, or 1 period if the pill has not been used properly. It's important to note that this medication has been prescribed to you because the benefit is greater than the risk of side effects for you. Many people using this medication do not have serious side effects, but it may raise your blood pressure. Monitor your blood pressure regularly and inform your doctor if the results are high. Seek medical attention if you experience unusual changes in vaginal bleeding, symptoms of a high potassium blood level, or serious problems from blood clots. Get immediate help if you have very serious side effects, such as lumps in the breast, severe stomach/abdominal pain, dark urine, yellowing eyes/skin, or mental/mood changes. In rare cases, a serious allergic reaction may occur. If you notice any symptoms of a serious allergic reaction, seek medical help immediately. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects not listed above. If you are a smoker and over the age of 35, it is important to avoid using Ocella, as smoking can increase the risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure when taking hormonal birth control. This risk becomes higher as you age and the more cigarettes you smoke. It is important to refrain from smoking or using tobacco while taking Ocella. Before taking Ocella, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions or other problems. It's also important to discuss your medical history, including any adrenal gland problems, blood clots, high blood pressure, cancer, diabetes, heart problems, kidney problems, liver problems, depression, and other conditions. If you have diabetes, Ocella may affect your blood sugar, so it's important to monitor your blood sugar regularly and share the results with your doctor. If you experience symptoms of high blood sugar, such as increased thirst or urination, be sure to notify your doctor right away. It's also important to inform your doctor if you'll be undergoing major surgery, will be confined to a chair or bed for a long time, or if you'll be using any other medications or supplements. Ocella may increase your potassium levels, so be sure to consult your doctor before using potassium supplements or salt substitutes that contain potassium. Additionally, this medication may cause dark areas on your face and skin, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you are nearsighted or wear contact lenses, you may develop vision problems, so it's important to contact your eye doctor if you experience any issues. It's important to note that it may take longer to become pregnant after stopping Ocella, so be sure to consult your doctor. This medication should not be used during pregnancy, and if you become pregnant while taking Ocella, it's important to notify your doctor right away. If you are breastfeeding, it's important to consult your doctor before continuing to breastfeed while taking Ocella. Now let's talk about the uses and interactions of Ocella. It's important to be aware of potential interactions with other medications, as they can affect how Ocella works and increase the risk of side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ocella include aromatase inhibitors, atazanavir/cobicistat, fezolinetant, and others. It's also important to note that drospirenone, one of the ingredients in Ocella, may raise your potassium blood level. Be sure to tell your doctor if you are regularly taking other drugs or products that can also raise your potassium level. Certain drugs may cause hormonal birth control to work less effectively, resulting in a higher risk of pregnancy. It's important to inform your doctor when you start any new drug and discuss whether you should use additional reliable birth control. Additionally, Ocella may interfere with certain lab tests, so it's important to let lab personnel and your doctors know that you are using this medication. If someone has taken too much Ocella and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's essential for individuals to take the prescribed daily dosage of Ocella at the same time each day to maximize its effectiveness. This medication is typically taken once a day, with or without food, and it's crucial to follow the instructions provided by your healthcare provider. If you have any concerns or questions about the best time to take Ocella, be sure to consult with your doctor for personalized guidance. It is important not to share Ocella with others. While taking Ocella, it is crucial to have regular complete physical exams, including lab and/or medical tests such as checking potassium blood levels, blood pressure, breast exams, pelvic exams, and pap smears. It is important to follow your doctor's instructions for examining your breasts and to report any lumps right away. Keeping all medical and lab appointments is essential. It is recommended to consult your doctor for more details. If you miss a dose of Ocella, you should refer to the product package information for advice on what to do. It is important to use backup birth control, such as condoms or spermicide, to prevent pregnancy. If you have any questions, you should ask your doctor or pharmacist for guidance. If you find yourself frequently forgetting to take your pills as directed, it's a good idea to talk to your doctor about possibly switching to another form of birth control. Make sure to store Ocella at room temperature, away from light and moisture, and do not store it in the bathroom. Keep all medications away from children and pets. Remember not to flush Ocella down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. If you have any questions about how to properly dispose of Ocella, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.